Hello, I'm Dr. Sindhu, one of treating doctor here today in the surgery. May I confirm your good name and age, please? Nice to meet you, Mr. Ali. May I know what brings you here today? Okay. Anything more? I'm really sorry to hear about it, Mr. Ali. I totally understand how stressful the situation would be for you. But Mr. Ali, I need to ask you a few questions in order to reach a diagnosis. So is it okay with you? Thank you, Mr. Ali. So, Mr. Ali, since when you are having a noisy breathing? Okay, is it related to some special circumstances like when you are tired and under rest? Okay, yes. And okay, so what is your position of lying while sleeping mostly? You sleep on your back. Okay, how many pillows do you use? Okay, do you know your neck collar size? Okay, it is 43. Okay, okay. Okay, Mr. Ali, have you felt an episode of choking while asleep? Okay, your wife noticed. Have you felt any headache in the morning? Do you feel any lack of freshness in morning and feel tired? Okay. Okay, so Mr. Ali, how likely it is for you to doze off or fall asleep while sitting and reading? Yes. And watching TV? And how about sitting quietly after lunch without alcohol? Yes. And what if sitting and talking to someone? No. Okay. And what if sitting inactive in public? Yes. Okay. Okay. In a car while stopped for a few minutes on traffic signal? No. Okay. In a car as passenger for an hour without break then? Yes. And do you feel excessive daytime sleepiness? Yes. Okay, Mr. Ali. So do you have noticed any change in your voice? Change in your weight? Do you know your weight? Okay. And do you have any difficulty in breathing through nose? Do you feel difficult in swallowing due to large tonsils? Okay. Is there any major medical problem in past, like a neck problem, like hypothyroidism or okay, any high blood pressure, high sugar? Okay, Mr. Ali, I'll ask you a few personal questions. Is it okay with you? Do you smoke? Okay. How many cigarettes per day? 2 packs per day. Have you ever tried to quit smoking? Oh, that's great. I really appreciate. We'll talk on it later. Okay. And Mr. Ali, do you take alcohol? Okay. Do you take any a drug prescribed by doctor or over the counter? And do you like to do exercise? No. Okay, what sort of blood do you like the most? Spicy and fried food? Okay, what do you do for a living? Okay, you're a clerk in an office. Okay, how's everything at home? At work? Okay, your wife, yeah, about your snoring. Okay, I totally understand, Mr. Ali. So, Mr. Ali, is there any, immediate family member suffering from same problem? No. Okay. Do you have any allergies? Okay, Mr. Ali, what worries you the most? Okay. And how it is affected your life? You cannot concentrate on your work. Okay. Okay, Mr. Ali. I'll need to examine you. Okay. Is it okay with you? Then I'll check weight and calculate BMI and neck circumference, and I'll inspect her right gland from front and from sides, and then I'll ask patient to swallow and a tongue protrusion. Okay, thank you, Mr. Ali, for your cooperation. I'll offer you few tests in order to confirm my diagnosis. Is it okay with you? Have you undergone any investigation before? No? Okay. Okay, Mr. Ali, here is a thyroid profile, okay? And let me reassure you, Mr. Ali, that during sleep, throat airway becomes narrow. And snoring is a vibratory noise generated as air passes through narrowed space, okay? And further narrowing produces louder snoring, okay? And labor inspiration and eventually choking episodes, which you stated. And increased efforts to start breathing is sensed by the brain, and transient arousal is provoked. So during night, hundreds of such transient arousals result in fragmented sleep and consequent daytime sleepiness. Is it clear to you? If it makes sense to you? Can I repeat again? Okay. Okay, so Mr. Ali, I'll ask you to follow effort sleep scale, which is useful assessment tool. Okay, and you have to fill that scale form. Okay, and I'll offer you some lifestyle changes for snoring without apnea. Okay, so I'll strongly recommend you to do not sleep on the back, instead sleep on the side. Okay, and keep end of the head end of the bed elevated. Okay, and limit number of pillow to one thick or two pillows. Okay, and I'll strongly recommend you to do brisk walk for 30 minutes per day for 5 days per week, or 150 minutes per week. Okay, and I'll advise you to stop smoking. Okay, and stop excessive evening alcohol. Is it clear to you? And and try to stop sleeping pills in the evening, and don't drive if you feel sleepy. Okay, because it will be harmful for you and those on the road as well. And for your wife and your partner, I'll suggest ear plugs to avoid snoring noise. Okay, and Mr. Ali, I offer to refer you to a sleep unit when a doctor will check your sleep problem, and he will do a study called polysomnography. Okay, is it clear? And if the choking episode of choking while sleeping, then maybe they will offer you CPAP. Okay, and it is continuous positive airway pressure. Okay, and if CPAP is not tolerated, then I'll be think about to refer you to a dentist or ENT specialist for mandibular advancement devices. Okay, and God forbid if your tonsils are enlarged, and maybe will need to refer you to an ENT for surgery. Okay, and I will strongly recommend you to inform DVLA. Okay, and other insurance companies. Is it clear to you so far? Okay, Mr. Ali, and I'll offer you nasal congestion. For your nasal congestion, beclomethasone nasal spray, you have to use it twice a day, and plus ipratropium bromide nasal spray at night. Okay. And Mr. Ali, and I will strongly recommend you to observe sleep hygiene. Okay, and don't go to bed until you feel sleepy, and avoid daytime naps, and don't eat, work or read or watch TV in the bedroom. Okay, and your bed should be comfortable, room should be warm and cool comfortably. Okay, and try to avoid caffeine, nicotine, alcohol at the bedtime, and have warm milk at bedtime, and avoid late night hard exercises, and try to follow routine, make routine, and rise at the same time in the morning regardless of how long you have slept. Is it clear to you? And can I repeat again for you? Should I summarize? Okay, Mr. Ali, is there anything you want to discuss with me or ask me today? Okay, Mr. Ali, thanks for your cooperation. I wish you a speedy recovery. Take good care of yourself. Bye-bye.